This video will go over the common and important questions that a patient might have about Toujeo Solostar Pen U-300. 1. What is Toujeo Solostar Pen U-300? And how does it differ from other insulins? A long-acting insulin called Toujeo Solostar Pen U-300 is used to treat high blood sugar in adults and children with diabetes who are 6 years of age or older. Toujeo delivers a consistent release of insulin over a 24-hour period, in contrast to other insulins that could need numerous daily doses, aiding in the maintenance of stable blood sugar levels both during the day and at night. Because of its increased concentration, some individuals may find it more convenient to deliver insulin in smaller doses. 2. How do I use the Toujeo Solostar Pen correctly for insulin injection? There are a few easy steps involved in using the Toujeo Solostar Pen. First, make sure there are no visible particles and the insulin is clear and colorless. Before using the pen for the first time, replace the needle, make sure it's functioning properly, and then choose the recommended dosage. Subcutaneously inject the insulin, preferably in the upper arm, belly, or thigh, rotating the injection sites to prevent tissue injury. For an example of correct technique, please contact your doctor. Proper technique is essential for efficient insulin delivery. 3. What are the possible side effects of using Toujeo Solostar Pen U-300? Toujeo is useful for controlling blood sugar levels, but it can also have unfavorable side effects, including weight gain, allergic responses, injection site reactions, and low blood sugar, hypoglycemia. Heart palpitations, sweating, dizziness, and confusion are signs of low blood sugar. Regularly checking your blood sugar levels and having a plan in place for handling hypoglycemia are crucial. Seek emergency medical treatment if you encounter severe allergic reactions or other major side effects. 4. How often should I inject Toujeo Solostar Pen U-300, and at what time of day? Normally, Toujeo is injected once a day, at the same time every day, to keep blood sugar levels stable. You can change the timing to fit in with your schedule and way of life, but for maximum control, consistency is essential. The ideal time for you will be suggested by your healthcare professional depending on your particular requirements and daily schedule. 5. Can Toujeo Solostar Pen U-300 be used with other diabetes medications? Indeed, Toujeo can be taken in addition to other diabetes treatments, such as short-acting insulin and oral anti-diabetics, to improve blood sugar management. To reduce the risk of hypoglycemia, it's crucial to regularly check your blood sugar and speak with your doctor about any prescription combinations. 6. What should I do if I miss a dose of Toujeo Solostar Pen U-300? As long as the missed dose falls within 12 hours of your next regular dose, take it as soon as you remember. If your next dose is less than 12 hours away, skip the missed one and get back to your usual dosing plan. To avoid increasing your chance of hypoglycemia, avoid taking an extra dose or increasing your next dose to make up for the one you missed. 7. How should Toujeo Solostar Pen U-300 be stored? Toujeo pens should be kept in the refrigerator between 36 degrees Fahrenheit and 46 degrees Fahrenheit, 2 degrees Celsius and 8 degrees Celsius, before first use. The pen can be stored in the refrigerator, below 86 degrees Fahrenheit, 30 degrees Celsius, or at room temperature after initial use. Keep out of direct sunlight and extreme heat. Avoid freezing, and throw away the pen if it has. Even if an insulin-containing pen is still in use after 28 days, it should be thrown away. 8. What are the signs of low blood sugar, and how should I respond if they occur? Low blood sugar symptoms include lightheadedness, shaking, perspiration, hunger, agitation, or difficulty focusing. If you have these symptoms, take a fast-acting glucose source, candy, juice, or pills, as soon as possible. After 15 minutes, take a break and check your blood sugar again. Keep a supply of glucose on hand at all times in case of an emergency. 9. Are there any foods, beverages, or activities I should avoid while using Toujeo Solostar Pen U-300? While there are no particular foods or drinks to stay away from, maintaining a balanced diet and keeping an eye on your carbohydrate intake will help you properly regulate your blood sugar levels. In order to ensure safe consumption of alcohol, Talk to your doctor about how it affects blood sugar levels. Diabetes care requires exercise, but in order to avoid hypoglycemia, check your blood sugar levels before, during, and after physical activity. 10. How do I adjust my dose if my blood sugar levels are too high or too low? Only with your healthcare provider's assistance should you adjust your dosage. To decide on the right changes, they will take into account things like your blood sugar trends, nutrition, exercise, and any additional drugs you may be taking. Toujeo diabetes management requires consistent monitoring and open contact with your local professional. 11. What should I do in case of an emergency or severe reaction related to Toujeo Solostar Pen U-300 use? Seek emergency medical treatment if you experience a severe allergic response, which includes breathing difficulties, swelling in the face, lips, tongue, or throat. Have an emergency plan that covers how to use glucagon, if prescribed, and how to notify close friends or caregivers on how to assist you in an emergency in case of extreme hypoglycemia or other urgent reactions. Wear a medical ID that lets people know you have diabetes at all times. This video will go over the common and important questions that a patient might